Now, have you ever dealt with pain right here in the lower back? And have you ever wondered maybe how to get rid of it? Well, today we're going to talk about SI joint pain and how exactly it happens. And most importantly, we're going to talk about how to get rid of it. Welcome to Move Here with Dr. Mike, where I provide you with weekly videos on how to stay flexible, strong, and living life with no limitation. If you're new to the channel, please take a second to hit that subscribe button below to support me. So let's go ahead and jump right into it. So if we take a look at Ricky here, how you doing, Ricky? Thanks for joining us today. We are going to look at the sacroiliac joint. Now, if we can see here, we have our sacrum, and then we have our two pelvic bones here connected, or what we want to call articulated to that sacral bone. Now, that sacroiliac joint is this joint right between the sacrum here. So typically people will present pain on the lower end of the pelvis, not in the lower back, but on the lower end here. Now, a couple causes of how this can happen. Women going through pregnancy or maybe have had a pregnancy, a lot of their ligaments in the pelvis become very laxed and loose, so they tend to be overstretched over time, which can cause some instability there. If you've fallen on your pelvis, or maybe you've gotten a car accident where your pelvis was maybe jarred or sheared next to the dashboard. Some people are maybe dominant on one leg. When they're standing, they tend to be kind of leaning towards one side, or maybe when they're sitting, they're always crossing one leg over the other. Those are other causes that can actually happen and cause some imbalances in the pelvic girdle. Now, typically pain will be presented on one side. Sometimes it's accompanied with some numbness in the hip, also in the posterior aspect of the leg, not really going down the leg. If you're noticing more numbness and tingling that are running down all the way to the leg, you might want to check with your doctor to determine what else might be going on in your lower back. But if we're talking about specific to SI joint pain, we're talking about it located on one side. Also, people complain of like a stabbing, real specific pain. It's even usually tender to touch. Also, when you're walking tends to make things worse because you're spending more time on one leg on that painful SI joint. So when you're taking large strides, when you're trying to run, it tends to be more painful for people. What I typically see people do is they try to walk it off, or they try to run it off, or try to keep moving, and the pain just continues to get worse. So we're going to teach you two muscle energy techniques that we're going to use today to help reset our pelvis and our hips, to help hopefully get rid of this pain. So the first technique we are going to use, we're going to be sitting. We're going to do both sides, so it doesn't matter which side you're going to work on. So I'm going to show you for demonstration purposes in the view of the camera how we're going to do this. So this leg is going to stay down, this leg is going to stay up, and what I'm doing with my hands is I'm pushing my hand down into my knee as my knee is pushing into my hand, and I'm matching that resistance, and I'm going to try to hold it there. Now, what I'm doing with my leg that's down is I'm actually pushing down into the ground. So just a reminder, this leg is pushing down into the ground, this leg is pushing up into my hand, and I'm holding it there for 5 seconds. 1, 2, 3, 4, 5. Then I'm going to alternate legs. 1, 2, 3, 4, 5. One more time. 1, 2, 3, 4, 5. And opposite side. 1, 2, 3, 4, 5. Perfect. Now, after 5 reps on each side, I'm going to take my hands or my fist, or you can take a pillow or a ball. And what you're going to do is you're going to squeeze as tight as you can, bringing your legs together. And what you might feel is an audible or a pop. Usually that is an indication that that pubic symphysis that's located right between your pelvis here is basically resetting. So usually it feels pretty good there. The second technique we're going to do is laying down. We're going to use a broomstick or a dowel for this next exercise. You're laying flat on your back. The stick or the broomstick is going to interlock between your legs. Now I have the stick going underneath one leg, but then the stick going over the top of the opposite leg. So I'll show you both sides. Same idea here. This leg is pushing down into the broomstick as this leg closer to the wall is pushing up. So I'm resisting the opposite motions, and I'm holding it for 5 seconds. 1, 2, 3, 4, 5. Then I'm gonna switch. I know it's a little confusing, but once you get the hang of it, you get it. Now this leg is pushing down into the stick. This leg is pushing up. 1, 2, 3, 4, 5. I'll show you one more time. 1, 2, 3, 4, 5, and 1, 2, 3, 4, 5. Good. So you would do 5 repetitions on each side. Once again, you can use a pillow or a towel or a half foam roll. Put it between your legs. After we've done 5 reps on each side, I'm squeezing my hips together, my knees together. I'm activating those adductor muscles. I'm holding for about 3 seconds, relaxing. And usually I only have to do that 2 times, and that's it. So after those techniques, we always like to re-educate the muscles of the pelvis. One of the best ways we do that is by working on a supine bridge. So after either you've done the sitting exercise or you've done the laying down exercise, you're gonna work through 5 controlled bridges to help kind of reset things. So you're just gonna come up and you're gonna slowly lower back down. And what we're gonna do is we're gonna do that for about 5 repetitions. Continuing to breathe. Not holding our breath. Okay, so we've provided 2 muscle energy techniques for you to use to help get rid of this SI joint pain. If you notice that the techniques that we went over today is still not helping, make sure you go see your doctor and talk to them about what can be done to help that pain out. Wanted to thank you again for joining me to watch this video today. Please, to support my channel, hit that subscribe button below and leave a comment, maybe of a question or a topic that you would like for me to cover. And remember, train smarter, not harder. Thank you.